Welcome to everyone. My name is Valerie Snyder, and I am a behavioral health nurse and certified health and wellness coach here at Mentavi. And before we begin this session, just want to make sure that everybody understands that this session is intended for adults and is for general education purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a licensed healthcare provider with any medical questions that you may have. So very exciting because February feels like the perfect time to talk about something that doesn't get talked about nearly enough, especially when it comes to ADHD, and that is relationships. So when we hear about ADHD, the conversation usually centers on work, school, or productivity. But ADHD does not disappear when you go home. It shows up in our closest connections too, often with romantic partners, friends, and family. And those patterns can sometimes affect the people we're closest to. So today's webinar is about understanding how ADHD can shape communication, emotions, and everyday interactions. So we can approach relationships with more understanding, patience, and supportive strategies. So let me introduce our guest of honor today, our psychologist for today's session, Dr. Amy Marschall.
It's great to be here. I am Dr. Amy Marschall. I am a licensed psychologist and certified telehealth provider and ADHD person. Relationships are something that I know a lot about, and I really know firsthand, personal and professional experience, how ADHD can create misunderstandings, not because we don't care, but because attention, emotion, communication all show up differently when you have ADHD. So today I am so excited to share my perspective as a psychologist and my own personal experience on what might be happening and offer some practical strategies that people might find helpful.
Awesome. Okay, so let's get started. Dr. Marshall, before we dive into the relationship dynamics, can you help set the stage for us? How common is ADHD and why does it matter when we're talking about relationships?
Sure. So ADHD is more common than people realize. The studies vary on the prevalence, but some estimates suggest that about 6% of US adults live with it, although other studies say it could even be more than that. That's millions of people navigating relationships with minds that work differently. When we understand that ADHD actually is pretty common, it can help take away some of the stigma and that isolation of, am I the only one like this? And it opens up the door for empathy over frustration. So if you have ADHD or you're in a relationship with someone who has ADHD, you are not alone. And this is a shared experience for many couples, families, and friendships. So with that context, let's talk about how things can get tricky in communication.
All right. So you're absolutely correct. Healthy communication is the glue that holds relationships together. But Dr. Marshall, what happens when ADHD is in the mix, and what do communication challenges actually look like?
Sure. So communication challenges when you or your loved one or both of you have ADHD can look a lot of different ways. One, interrupting without meaning to because the thought feels urgent, might disappear, or just really feels like it needs to be said immediately. Zoning out, losing focus in the middle of the conversation, not because I don't care what you're talking about, but because my attention got pulled somewhere else. Forgetting to follow through on things that are important, even if we genuinely care about those things, and losing track of details, forgetting details from earlier, like from an earlier conversation. So if you are on the receiving end of these challenges, you might feel like you're not being heard, that you're not valued, that the things you're saying aren't important to the other person. There's the saying of, if it's important, you'll remember. That is not true when you have ADHD. Very important things can be forgotten. But over time, this builds frustration on both sides. And if you don't understand why this is happening, the small moments can build into resentment. We want to reframe this because it's not a character flaw. It's an ADHD related pattern showing up in real time in the interaction. So understanding that and naming it can change everything. They're not ignoring, their brain got pulled somewhere else, and maybe they're working on strategies to be able to stay present when they really want, like, I can't emphasize this enough, they want to stay present. It's not a choice. So some tips to structure your communication to kind of mitigate some of these ADHD effects can include writing things down together, like notes, lists, shared family calendar, having a daily check-in time, even just 5 minutes to sync everything up, using reminders for follow-ups on things that are important, and repeating, when you have ADHD, repeating back what you heard to confirm that you understood and to help kind of drill it into your memory.
Okay, well, those are all really good tips. Thank you so much.
Mhm.
Now, here's the thing. When things feel extra intense, Dr. Marshall, can you talk about how emotional regulation and something called rejection sensitivity dysphoria, or RSD, as some of us may have heard it referred to? Um, th- I think this is something a lot of people experience, but they don't really have the words for. So can you tell us a little bit more about that?
Sure. So this comes from emotional intensity. So ADHD brains often experience emotions more strongly, both positive and negative emotions, which can lead to more difficulty regulating because it's a bigger emotional response that we have to cope with. This can lead to disagreements escalating quickly, might appear dramatic, but that's not what's happening. It's that emotional experience genuinely feeling more intense. So RSD, rejection sensitivity dysphoria, it's not a clinical diagnosis that's listed in the DSM, but it is a phenomenon that has been documented in the research. It's a term that's used to describe an intense, sometimes even physical pain that can come from real or perceived rejection or criticism. And it can be confusing concept because who likes being criticized or rejected? But it goes beyond just people don't like being criticized. It's that intense discomfort, even pain that comes with both even if there is a rejection or if I perceive that there could be a rejection. It's like a gut punch over something that might seem minor to others. And it's not about being too sensitive. It's that the reaction is overwhelming. So this can show up as interpreting neutral feedback as criticism, shutting down or withdrawing in difficult conversations or conversations that involve real or perceived rejection, appearing to overreact to comments or changes in tone, anticipating rejection before it happens and pulling away. And it occurs because we have those bigger emotional responses, and people with ADHD often have more history of being rejected. So we're maybe more primed to be looking for that. So if your partner or your loved one experiences RSD, understanding it can really help those interactions because the emotional response can be confusing when it looks like it's larger than maybe the situation could call for. Remember that it's not manipulation, it's not attention seeking behavior, it's a reflection of the actual emotional response that the person is having. So, pausing before reacting on both sides can help with this. So, both sides practicing a moment of pause before responding to a conflict, having the person with RSD naming what they're experiencing, that I'm having a big reaction right now. I need to take a beat. Having a signal, even if it's not like I am struggling, like even just like a code word that means my emotions are getting high and I need to be able to take a break. And then coming back to the conversation after you both had a chance to regulate.
Awesome. Okay, so all great tips, and definitely can see some of myself in, in those scenarios. So we have talked about the challenges, but ADHD in relationships isn't all hard. So, Dr. Marshall, what are some ways that couples, families, and friends can actually strengthen their connections?
Sure. So there's a lot of ways to do this. First, naming patterns. So recognizing that intensity and forgetfulness might be ADHD versus not actually caring. That can reduce blame and shame, both internalized for the person with ADHD and being received from others. It can really, really help your self-esteem to be shifting from what's wrong with me to just this is how my brain works. I can work with it. I might need extra help, and that's okay. And so both sides benefit from this reframe. Building compassion. So learning about ADHD can build empathy, and it can create a shared language for the challenges that you're experiencing. And remembering that it's not an excuse. I'm not saying, oh, I have ADHD, so I don't need to try. I'm saying I have XYZ brain differences and needs that are valid and require support. When there is a challenge, collaborating on a solution rather than blaming the person. So approaching the challenge as, okay, how can we solve this together? Avoiding keeping score, cataloging, bringing up past mistakes, and really, really celebrating the wins, even when they might seem very small. You can also seek additional support, therapy, and there are ADHD coaches that can help people who have ADHD build self-awareness, strategies for executive dysfunction, all of that. There are couples counselors specializing in when one or both members of the couple has ADHD, or couples coaches to build relationship skills, helping both partners communicate in a way that works for both of you. Learning together creates that shared understanding, and it avoids that this person is the problem who needs to fix it. It's we're both working together to improve our relationship. ADHD doesn't define your relationships, but it can shape how people connect. So the key is to collaborate rather than blaming, and having compassion rather than judgment and shame. It's part of the landscape that you're navigating together. And the more we understand and the more supportive strategies we have, the more relationships can feel connected and resilient and healthier over time.
All right. Well, I do want to thank you all for being here today. Relationships do take work for everyone, but when ADHD is part of the picture, having the right understanding and tools do make all the difference. So if today's conversation resonated with you and you'd like either individual coaching, or therapy, we are here to help. So whether it's building better communication strategies or learning to manage emotional intensity or just having someone in your corner who gets it, that's just one way coaching or therapy can help support you. So you can book a 30-minute session directly through our patient portal. That's a coaching session. Or you can also reply to the follow-up email that you're going to receive with a recording to the video, I believe, to the recording of this meeting. And that will also include a link to schedule as well. So I really want to let everyone know that we appreciate you taking time to hang out with us today, and take care of yourselves and look forward to seeing you all at the next one. Thank
Thank
you.
you.